This is a hospital in Tanzania in Eastern Africa. The rooms have been thoroughly cleaned. Medicines and medical supplies are neatly organized. Waste bins are color-coded for each type of medical waste and placed in designated locations. Even the storage area and offices are clean and well organized. But this wasn't the case just a few years ago. The hospital was in a terrible state, one unimaginable now. The records room was a complete mess. Medicines weren't organized properly, and satisfaction in hospital services was low among patients. What made all the difference was Kaizen.
After Kaizen, then we have reduced the amount of money which we used to do previously.
We decreased the cost, and then we are working nicely, and people, they are happy with their work. They can see everything. Everybody is happy. Patients are coming, and some of them are appreciating our environment, our arrangement, the good kind of service.
Kaizen has completely revolutionized this hospital. Through Kaizen, much higher quality of medical services can be provided, and waste and excess can be reduced, keeping costs down.
Hospitali ya rufaa kwanza kabisa ina huduma nzuri. Kwanza kuna usafi wa hali ya juu. Ukianzia nje mpaka ndani.
Huduma yao ni nzuri, hata mapokezi yao ni mazuri, kwamba labda ukifika hapa utamwona daktari kwa wakati na utatibiwa, utajisikia huru tu.
So what is this approach, Kaizen? Hospitals employ not just doctors and nurses, but a wide range of personnel. Everyone working in a hospital is very busy, and the complex nature of the facility means that problems can occur in various areas and processes.
Before Kaizen, we have many problems which was not solved. Like in my place, we have many machines which was broken. We have many things that we was retrying every day, then increase the cost.
At hospitals, it is vital that staff members work in teams to address these problems continuously under the strong leadership of the hospital management team. Solving these problems enables the hospital to provide even higher quality services that earn the trust of patients and also keep employees satisfied. Kaizen is a problem-solving approach. Here's how it is being used. In Japan, Kaizen is employed not just in the manufacturing sector, but also in healthcare. Here's one example of how Kaizen is put into practice at a hospital in Japan. This is Iizuka Hospital, the core healthcare provider for the region around Iizuka City in Fukuoka Prefecture. Iizuka Hospital adopted Kaizen practices early on and saw the results quickly. Some examples are arranging medical records on shelves for easier access, placing guiding lines on the floor, clearly organizing medical records in chronological order. These are just some of the Kaizen activities conducted in Iizuka Hospital. They have led to a variety of solutions both in medical work and in general administrative tasks. As part of their Kaizen initiatives, hospital employees work toward TQM, or Total Quality Management. How can TQM make a difference in hospitals?
TQM 活動によって、実際に各部署にそれまで存在していた問題や課題がこれは半年間の活動によって改善されるわけですね。でその結果として、職場環境が改善したり、あるいは医療の質が向上したり、無駄が削減されたり、そういういろんな効果が、 生まれる。
Kaizen is not a top-down directive, but a bottom-up approach in which employees solve problems they notice from day to day in their workplaces through the power of teamwork. As for the system through which Kaizen activities are implemented, actual activities are handled by work improvement teams, or WIT, that are formed in each department, and these are directed by department heads and nurse managers who form a quality improvement team, or QIT. The WIT then takes 7 steps to perform Kaizen activities. The 7 steps are: selection of Kaizen theme, situation analysis, root cause analysis, identification of countermeasure, implementation of countermeasure, check effectiveness of countermeasure, and then standardization. Now let's see how Kaizen activities are implemented along each step of the process. Step 1 is the selection of Kaizen theme. In this step, employees discuss the issues they face on a day-to-day basis in their department and decide which ones to prioritize for their Kaizen theme. These nurses felt that they were so busy with administrative tasks that they had little time to spend at patients' bedsides, making them unable to give sufficient nursing care. Then, they select themes using a matrix diagram like this one. Possible Kaizen themes are listed on the left axis, while across the top are evaluation categories for the themes, including immediate effect, urgency, and feasibility. As a result, streamlining operations has been selected from the 3 possible themes, and the employees have made shortening hours spent on administrative work their target.
仕事が忙しく業務に追われることで患者さんと時間を取ることがなかなか取れなくって、一番には患者さんとの時間を多く取り寄り添う看護がしたいなということがきっかけでした。
Step 2 is situation analysis, assessing and analyzing the current situation. Here, the team assesses how much time is being taken with day-to-day work. For example, supplies needed for patient care were not located near the rooms, requiring nurses to travel long distances. And medications were being dispensed at nurse stations, even though this task could be done at patients' bedsides. Handover from night shift to day shift nurses also took place at nurse stations, forcing the nurses on duty to spend a long time away from the patients. Assessment and analysis of the situation is conducted through creation of a Pareto chart, which is made of a bar graph and a line graph. The horizontal axis shows the factors composing the problem in the theme. This lists factors such as wasteful movement, tasks that could be done at bedside being done at nurse stations, and other issues that complicate daily work. The vertical axis on the left shows the frequency of the factors contributing to the problem, which is shown in the bar graph, and the right shows the accumulation ratio for these frequencies, which is shown in the line graph. Factors with high frequency of occurrence are then chosen as the factors to tackle. Step 3 is the root cause analysis. The root causes of the contributing factors are identified using this fishbone diagram. The diagram is so called because it resembles a fish skeleton. A straight line is drawn toward the contributing factor in the head. Then, branches of general classification are drawn, which are subdivided into more specific causes. From this analysis, the team can identify what kinds of countermeasures are necessary. Step 4 is the identification of countermeasures. Here, specific proposals are made for countermeasures that were identified in the analysis of root causes. First, this tree diagram is used to list countermeasures systematically, to find the best means and methods to achieve the goal. Next, a matrix diagram is used to find the feasibility of the identified countermeasures from various perspectives, including urgency and practicability. As a result of their analysis, the team proposed countermeasures for shortening travel time and performing several tasks at bedside. Step 5 is implementation of countermeasures. These are implemented based on the results of Step 4, the identification of countermeasures. Dispensing of medications now takes place at the bedside rather than at the nurse station. And handoff from night to day shifts is now conducted in patients' rooms, so on-duty nurses can stay by the patient's side. Supplies needed for patient care are now kept in shelves near the rooms, which reduces travel time. Step 6 is to check the effectiveness of countermeasures. This verifies the effects of the implementation and countermeasures. Here, the nurses use a stopwatch to time their travel and see how much time they've saved. This Kaizen activity has increased average daily patient care time from 59 minutes before implementation to 234 minutes. The final step is standardization. This step ensures that all employees practice standardized and effective countermeasures. This team produced a manual to ensure that the countermeasures are performed in a standardized manner. The 7 steps in Kaizen are planned and implemented over a 6-month period, then evaluated for their effectiveness, and after that, the next theme is selected. Each rotation keeps the cycle moving upward like a spiral staircase.
みんなで力を合わせて試行錯誤しながら活動を進めていって、そして最後には非常にみんなで大きな達成感を感じることができるという、この TQM 活動のプロセスがですね、これが現場のチームに結束力をもたらして、現場を活性化する、そういう効果がある。これはもう間違いのないことですね。
Kaizen was influenced by quality management techniques originally taught to Japanese corporate managers by American statistician William Edwards Deming. Kaizen was later expanded upon by Japanese manufacturers, and today it is being implemented around the world as an approach to improve quality in the manufacturing industry. Kaizen started to take root in the healthcare industry in the late 1990s, when there were increasing reports of medical accidents both in Japan and abroad. This marked a change in philosophy from medical doctors do not make mistakes, and accidents are the individual's responsibility, to people make errors, and a system that makes errors unlikely is needed. Later, the effectiveness of TQM in the health sector was validated extensively in the United States, and Kaizen in the medical field spread throughout the world. Now it is being applied to healthcare quality improvements and to hospital management. One example is at the Virginia Mason Medical Center in Seattle, a focus of attention in the United States as a hospital that proactively employs Kaizen. And today, Kaizen is being implemented in healthcare settings in countries throughout the world.
Quality is really a fundamental precondition of any health system anywhere in the world, and Kaizen really affords a bottom-up approach to quality improvement, which can be sustained over the long term. The World Health Organization is always looking to these types of experience for global application to improve population health across the world.
One example of successful 5S and Kaizen adoption in a developing country was at the Castle Street Hospital, a public hospital in Sri Lanka. JICA, Japan International Cooperation Agency, analyzed this case study and came up with an effective approach toward improving healthcare, which is called 5S Kaizen TQM. It begins with introducing 5S, then introducing Kaizen in a stepwise manner, and places TQM as the ultimate goal. 5S, which stands for sort, set, shine, standardize, and sustain, aims to improve the physical working environment through an employee-led approach. By starting with 5S, which can make visible changes in the workplace, it can build motivation among employees and an organizational foundation towards further quality improvement. The next step is Kaizen, which is an incremental and continuous employee-led process for solving workplace issues. It works to improve quality, safety, and productivity in medical care by eliminating all forms of waste and irregularities in workplace tasks and processes. And then the ultimate goal is TQM, through which Kaizen is practiced throughout the organization, meaning the organization is operating more effectively and more efficiently, and its functions are optimized across the board.
This is just simple things. Yeah?
This is Hisahiro Ishijima, a JICA expert in the area of 5S Kaizen TQM. We asked him about the significance of introducing Kaizen in developing countries.
多くの途上国はですね、保健資源の不足、保健人材であったり保健財政、医薬品、消耗品などの、保健資源が不足している中、非常にサービスを、提供する上でですね、難しい状況に陥っていると。でこの改善というのはですね、無駄をなくし、業務を効率化させていくという、非常に効率化を目的とした手法ですので、それらをですねうまく使っていってですね保険資源が適切に使われサービスが提供できる状況を作っていくというのが大きな意義だと考えます。
As of 2015, through JICA's cooperation, 5S Kaizen TQM is being implemented in over 500 healthcare facilities in 22 countries throughout the world. This is Tanzania in Eastern Africa. Here, under health policies that promote 5S Kaizen TQM, the approach is being implemented at 67 public hospitals as of 2015. This is Mbeya, the main city in southwestern Tanzania. It's home to some 280,000 residents. At Mbeya Zonal Referral Hospital, 5S Kaizen TQM was first employed in 2007 with support from JICA, and 5S is now being fully implemented. The hospital is now moving toward the Kaizen steps. QIT members frequently come together in a meeting to discuss Kaizen processes inside the hospital. How can introducing Kaizen improve this hospital?
Previously, many times staff were blaming the management, but through Kaizen, they start themselves to make analysis how or what is a problem and what can be done.
Let's take a look at some examples of how Kaizen has made a difference here. Before Kaizen, medical waste was not being segregated properly.
Before Kaizen, there was a problem in the side of waste segregation. Normally, we have to follow standard of waste segregation following IPC guideline. But there was no following of that guideline.
Inappropriate segregation of medical waste raises the risk of infection within and outside the hospital. So this was chosen as one of the Kaizen themes for improvement. Here is the situation analysis based on the theme. Waste containers were color-coded according to the guidelines, but the wrong color waste liners were being used or no liners at all. In the root cause analysis, the team found that lack of knowledge about segregation among employees and improper inventory management were leading to purchases of excessive amounts of the wrong color liners, and shortages at the medical stores department were making it impossible to procure liners. Therefore, one of the countermeasures was to improve inventory management for liners and also to produce the liners in the hospital rather than purchasing them. This Kaizen method made liners more readily available, improved the segregation of medical waste, and cut costs in half from when ready-made liners were purchased.
Waste bag, that's liners, utilization in 2018 was reduced from 18 plastics rolls up to 9.
The liners made in the hospital were also placed in each department, simplifying segregation of waste on the departmental level.
Big improvement of the waste. People are following guidelines. Waste are being segregated according to their colors.
Let's look at another example of Kaizen. This is the CSSD, or Central Sterile Supply Department, where medical instruments are cleaned and sterilized.
Probably in the theater, surgeons was complaining sometimes that the instruments were not complete.
Complaints came in from operating theaters and hospital wards saying that sterile materials were not being packed properly. Investigating the cause, the team found a problem with the checklist in the workspace where sterile materials were packed.
Before we have this small Kaizen, we have only checklist without instrument shows down. So we get many complaints from users that something is missing in the trays.
Therefore, the team decided to post a photograph at the workspace under the checklist. This eliminated the need for personnel from operating theaters and wards to come to CSSD looking for sterilized instruments, reducing delays in treatment. Dar es Salaam is Tanzania's largest city. This is Muhimbili National Hospital, the largest hospital in Tanzania. Muhimbili National Hospital is the top referral hospital in Tanzania, accepting referrals from hospitals throughout the country. And here also, Kaizen is being implemented with support from JICA. Records of Kaizen activities are posted in various areas of the hospital.
As we know that Kaizen is a problem-solving process, so here at Muhimbili National Hospital, in the wards, even in the clinical settings, we had some problems. We noticed that by implementing Kaizen, you can solve the problems without much resources.
Let's look at several examples of Kaizen at work in this hospital. The first is improvements made to reduce the number of patients with phlebitis.
Many patients, more than 70%, develop phlebitis. Some of them present with redness, swelling, abnormal temperature. We conduct a discussion with the HealthJICA about how to reduce this problem of phlebitis. The same which goal to reduce is to start the KAIZEN.
The staff conducted KAIZEN activities based on the 7 KAIZEN steps. They held meetings over 6 months, analyzing the root causes and identifying and implementing countermeasures. The team showed us records from 6 months of its KAIZEN activities. We can see that extensive details were covered over many meetings.
Second,
before KAIZEN was 70% patients who developed phlebitis. But today, I have to say about now, we have almost like 10%. So I think this has reduced a lot.
Now, they've produced a standardized operation procedure that the staff members follow to give patients higher quality care. The next KAIZEN example is the reduction of improper blood samples for testing. Investigating the root causes, the team found that proper training on drawing blood and handling test samples was not being provided, and staff members were working without knowledge of proper methods. Therefore, the necessary training was provided to the staff and a standardized manual was produced so that anyone could collect blood samples properly.
The staff are solving their own problem with less resources, so they don't need much money to solve their problems. And for the staff themselves, they are motivated because they work in the environment where they can solve their own problems.
This is the city of Mwanza on Lake Victoria. At Bugando Hospital in Mwanza, a workshop on KAIZEN was held for medical professionals.
Okay, so other African countries are looking at the success of the
JICA expert Hisahiro Ishijima also led the workshop as an instructor.
Okay. 研修で学んだことをですね、持ち帰っていただいて病院の方々に共有していただくと。KAIZENというのはやはりその組織の働く人たちが自らの気づきで行っていかないといけない活動ですので、我々としてはですね、技術的にその活動が進められるように協力していくというふうに考えております。
Eleuter Samky, who first took part in JICA training conducted in Japan and Sri Lanka, and then introduced 5S programs to Tanzania, tells the younger staff members about the significance of KAIZEN.
The purpose of introducing KAIZEN to hospitals, particularly the hospitals in Tanzania, is to make proper and efficient use of the resources, small resources that are available, so that better and good quality is obtained. Every country, every organization that has a resource-limited situation, KAIZEN is the way.
This is an approach that can improve healthcare services in resource-limited settings, and workshop participants are very enthusiastic and eager to learn and adopt it.
We believe KAIZEN is a promising approach to strengthen health systems toward universal health coverage. Service coverage without quality means nothing, and hospital efficiency is vital for strengthening health systems sustainably. So therefore, we are looking forward to working with more partners to promote 5S KAIZEN TQM.
This is the TQM conference conducted every year at Iizuka Hospital. Each team announces their KAIZEN results. This conference is a competition in a good sense. The competitiveness leads workers to provide better quality healthcare services. Kaizen is not something that's done for you. It's something that starts with you. Because you are the one who can improve healthcare services and make your hospital a better place.
Hapa Kaizen inawezekana.